I'm used to people having to like, all of a sudden they swarm and they're right here.
We're giving you yours.
Thank you. And is this view okay, or would this foot actually be better for the angle?
No, I think this is fine.
Okay, thank you. If you get excited and you want to jump in for any of this, Jill, you can tag team in. Did you want to add anything about the pecs or pin and stretch?
I did, and now it is left me.
Okay.
I'm sorry. Yeah.
Sorry, I didn't ask at
No,
the
no,
time.
that's okay. I have a question.
Yeah,
Like,
of course.
I'm super short, and I feel like I'm always bumping or something. Or is there a different way to kind of pin and stretch when I feel like I'm sorry. Help me.
Yeah. Let's work together when you practice it, and I'll help you find good positions. It's kind of a little bit of modifications everywhere. I get that question sometimes too from large-breasted women who are like having to adjust to not hit people. So yeah, we'll work on some maneuvers. All right, so everything you've done with the hot stone massage so far and everything you've done with foot massage so far, you know, you can play with all of it. Of course, we're modifying for not hitting bony landmarks. So right now, as I'm kind of warming up, you know, in this arch and the dorsal surface, I'm using this edge of the stone and kind of leaning into it with the back edge of my hand. But I'm very careful of these bones right here. And we already checked in earlier about his feet, and with frequent standing and walking around at work, there's been a soreness developing around the heel, but it's been after he's standing at work a lot. And so I asked when he feels that, because sometimes that area of pain, especially if it's worse in the first few steps in the morning, is an area that can be sort of indicative of possibly plantar fasciitis. But with the worsening at the end of his workday, and he thinks he might just need to change the orthotics in his feet, in his shoes. So just checking in on that.
Can you use the tip of that to go like in between the bone landmark on the front of the foot?
Yeah, you can. I can move there next. I was going to move to the heels next, but I can move there next. So I like to kind of warm up, you know, with my hands a little bit, and then you can use kind of those soft techniques. But you can use the point. There's acupressure points right here on all the toes. That's nice to open them up. Now, of course, this is pretty bony in here on this dorsal surface, so you can do things like protect the stone from sliding with your other fingers. So I'm nice and secure as I kind of roll in here. And I'm being very nice and soft and supportive with the rest of my hand. So this can feel kind of yummy and relaxing, and not just like I'm just pushing a stone in this area. And then I'm rocking through here. And there's also really wonderful acupressure points right here. This is liver 2 and liver 3. So this hand is supporting. And how's that pressure? How's that feel?
5.
Okay. You would like more? Okay. And there's a tight spot. And how about now?
6.
Okay. And now?
7.
Okay. I was going on the cautious side because of this bony area, but of course, notice how I checked in and adjusted. And similar in the other metatarsal area, but the other spaces are even smaller. So you want to be careful not to bump into bony landmarks. I kind of like to slide through as I'm warming up. And I'm going to get just a warmer part of the stone engaged here. There we go. get a little stretch in there. It can feel really good to add a little flexion to this. People oftentimes love flexion stretch there. And a lot of times people have often asked in here about like the order as far as like the feet, and you know, if it works for the sequence of your massage, sometimes it can be nice to save the feet for last as far as cleanliness, or you could clean the stones. You saw how easy, quick they are to clean. This thumb and hand is supporting under the work. And getting some nice movement as well.
Digging in with your thumb.
I was pressing in with my thumb. Yeah. I wouldn't characterize it as digging in, but yeah, I was getting in there. I do a little bit more warm up and then get to the ankles. You may recall the kind of sandwiching maneuvers we did before. And I'm going to get around the ankles. Some rolling. Careful of the bony landmarks or medial malleolus in this case. And you can even support the ankle to get in those joint spaces better, get a little range of motion. And it can be tight here where the Achilles tendon is meeting up. So I'm offering a little traction and I'm holding from this part of the stone to use that point and really pull. And a little circular motion with the tip.
Sorry.
With pressure here. Thank you. So I'm using good strength here to have a circular motion with the tip here and support on my other hand. And don't, again, like we did with foot massage, don't be afraid to really move their foot around, right? You know, offering traction, stretches, you know, pressure to support the foot. And even turning it out or in. How's that pressure?
6,
Okay. And how about now?
7.
Okay, cool. Now, my body mechanics is not perfect, but notice when I had to apply pressure, instead of stressing out and tightening up, I try to actually loosen up, take a deep breath and relax into it. Sometimes you can feel like if somebody says 4, 5, 6 or whatever, and you're trying to get to a 7, sometimes there's a tendency like you try to use more effort. Try to actually like relax and just shift your body so you can make that adjustment in an easy way. I'm going to come around the corner to where he was actually experiencing some pain at work. And of course the teardrop shaped stone is nice for the tip here. And doing some nice dorsiflexion as I'm applying pressure. That's helping me work through the layers. And again, don't be afraid to, you know, move their leg and their foot to get to the angles that you need. So as I get around to the lateral border and support. his foot for that work. And using the rolling. It's a mystery why it times out. I'm using a good amount of pressure with my left and my right hand to get some good dorsiflexion and some good pressure with the stone. You can see from the movement of his bones, right? That's sinking in. And how's the pressure there? Gabriel, on a 1 to 10 scale, how's the pressure? Okay. Cool. Excellent. Thank you. All right, and I'm going to get a fresh stone, work a little bit in the solar plexus area as far as reflexology and up in here. And then we'll call it good to give you guys a good practice session. I am not using much oil because the feet, I find with the thick skin of the feet that the oil is actually too slippery. And so I don't want to slip and slide here. You know, I'm not doing a lot of gliding movements here. I'm sinking in. So you maybe notice I did not apply oil. If you're sitting down on these rolling stools, you know, you can usually wrap your legs around the table if you're sliding too much. This hydro table is the only table that I can't do that with. And like the thumb inchworm, you can kind of replicate the same sort of pattern. I was just warming things up, but when they're warmed up, if you want to get really specific, you apply your pressure, you move on a little bit, you apply your pressure, so forth. Repeating, you can crisscross, you know, different directions. You can go straight up and down in line with the toes or side to side or both. And then just like with your reflexology, remember all the little surfaces are nice. So just as an example, but not to make the demo too long, I'm going to show that even on the edges of the toes and in what reflexology would be the neck area, you know, don't be afraid to really use the edges of the stone in there. And notice that just like with our foot reflexology and foot massage, I'm just supporting the toe really well so that it's not, you know, kind of flip-flopping with that pressure. And then similarly, with good support on the toe, good support behind it, good support in front of it. You can even do rolling motions, pressure through the whole toes, and even the tips. When I do the tips, I like to support like this. And again, this can open up the flow of the meridians, which start and end here. And in reflexology related to the brain and sinuses, the head. So like that. And then just like with hot stones, you can also incorporate your massage and don't feel like you always need to have a stone in both hands. Your static hold, if you were to end with one, could be with or without a stone. If it's not too hot, if it's too hot, you know, get some of the heat off and move it around. Is that good amount of heat or too much?
Oh, that's good.
Okay. So I'm just going to do a little static hold here to end. And we stop there.